Good afternoon, everybody. We are here again at our 3:30 briefing to talk about what's happening in Eau Claire County related to COVID-19. Thanks again for joining us. We know that this issue continues to be a challenge for all of us, and we appreciate people joining to find out what's happening in our community and to share the messages that we think are so important. So thanks for being part of that. Today and on subsequent Wednesdays, we will be having local government share with us what they are doing specifically to prepare. And today, Dale Peters is with us to give that perspective. Again, many of these media events, we will be having others join us to share with you all what is happening and to give you some perspective on what's going on in the community. So, status today in Wisconsin, there are 585 positive COVID-19 cases, 6 deaths, and more than 10,000 negative tests. That is a significant increase if you've been following the numbers, really due to an increase in testing and an increase in positives with that testing. Wisconsin is now considered a state with community spread, so no longer are they identifying specific counties with community spread like they were previously. Now we are considered a state at its entirety with community spread. Again, that reinforces why we have a statewide order, a stay-at-home order. The idea of that order, which we'll talk about in a minute, is really to keep people home to avoid continued community spread. In Eau Claire, we have now 6 positive cases, 352 total tests, and 223 negative tests. In the last half hour, we got our most recent positive case. That is number 6, and we are investigating that now. It is a travel-associated case. I do want to remind people that when people are tested and the positive cases we have and the many people that have been tested, those 352 tests that have been done, people are to stay home if they have had a test done, even from essential things. So while our order talks about be able to go out for essential services and for essential functions, grocery shopping and those things, people that have been tested and are awaiting a test result need to stay home. If you are sick, you also need to stay home. We can't have, even for essential reasons, people being out unless they are accessing an emergency room because their illness is that severe. Again, as we regularly tell you, please go to our website. That is where our most up-to-date information is. We also have been talking regularly about our COVID hotline. We, as of this morning, have moved to a call center. In moving to the call center, we have access to a larger ability to answer calls in real time. And we really appreciate all the volunteers and staff that are doing that, as well as UW Eau Claire, who has given us a space to do that. That call center has a new phone number, so I will be repeating that number during these webcasts, but a reminder to our community partners. The new number for the call center is 715-831-7425. The old number will transfer there, so if you have that old number and use it, do know you'll get somebody eventually. But if you have questions about COVID-19 in Eau Claire County, please use that new hotline, 715-831-7425. It will be staffed Monday through Friday from 8:30 to 5, and on weekends from 9 to 4. If you call outside those hours, those messages will be checked and we will follow up as soon as possible. If you'd like to volunteer for that kind of an effort or any other, we will have an opportunity to provide information as a volunteer on our website in the near future. An additional update is related to childcare. We do have a team in Incident Command working closely on childcare with all our regulated and licensed centers. And again, we have space in those centers, and if there is a need for space, please contact 1-800-782-1880 or on the web childcarereferral.org. We have recognized that there is a need for overnight and infant care, and we're working on that as well. We've mentioned a lot in these news conferences incident command. That's a foreign term to most people, and I just want to take a little time to talk about what does that mean and why do we use incident command. In many emergencies, small and large, our systems use incident command to organize how we get work done and how we coordinate the work we do, whether it's a flood or a tornado, or in this example, a large communicable disease outbreak. Incident command gives us structure and language and tools to get the work done as seamlessly and efficiently as possible. It is a bit of a foreign language, and the structure may seem a bit foreign, and I'm just going to walk through a little bit of what we are using. I am the incident commander. So yes, I am the health department director, and most people recognize me as that. But in this incident, I am really functioning to oversee what is happening broadly across the community as we respond to this large event, not just what is the health department doing. So again, my job is to work with all of the leadership of our incident command, and those leaders include the following spots. I'm not going to name people, but just so you get an idea. We have someone that is the liaison. That person is making sure that we're connecting with governmental entities across our county to be sure that we have information flow back and forth between those entities. Dale happens to be our liaison officer, and he is talking with you today in that role. We have a safety officer who's making sure that the people that are responding to this incident, that we're paying attention to their health and safety in all kinds of ways. Our public information officer that's the group that helps plan this event and all of the public information that goes out to all of you. And we have a legal team that is really working on, are we making sure that the things that need a legal touch have it in this incident? The work happens then in 4 different groups. So operations is the biggest place. That's where we are responding to the incident in real time. We are making sure that we are meeting the needs of the community as a whole, from health department doing case investigations to working with healthcare on what their operational needs are, to making sure that our first responders know what to do when they are going out in the community. That's all in operations. Planning is thinking ahead and helping us make sure we're doing this event in an efficient way. Logistics make sure that we have the people and the assets, those things that we need to get the job done, that we have those available to us. So they are working on all kinds of things like volunteers and equipment and those kinds of measures. And then finance administration makes sure that we think through how do we have money in and money out and resources in and resources out in an effective way. All of those parts of incident command that I mentioned have lots and lots of people working in it. So it's complicated, but it's important that we have structure so that we are communicating with each other and we're getting work done. Know that someone might be contacting you that you know that has a different role in day-to-day life, but today and this week they've been working in incident command and now have a new role and new title because of the work that we're trying to do. So Governor's Safer at Home order is the biggest news of today. It started at 8 this morning. We expect as of 8 this morning that order is being followed. It is a big change in our state and in Eau Claire County, and we recognize that. We are continuing as our many partners to analyze that order and look at the subtleties and the details in it. There are resources available to answer questions, including our COVID call line, and we're getting lots of questions about it. I'm going to share some of the information that we've been hearing from others, and certainly we can answer additional questions after we get done today. So traveling is something that can happen for essential functions, going to the grocery store, going to work if you're an essential worker, getting your medications, those kinds of things that are articulated in the order. You do not need to have any papers with you to verify that what you are doing is essential. We're expecting people in Eau Claire County and in the state to be traveling only if they need to and following the orders. We are assuming that according to the orders, things are closed and people are staying home. We do have enforcement ability if we need that. We have met again with the legal team and with all of our local law enforcement about how this is being enforced in Eau Claire County. And we do have the ability to enforce. We don't want that to be the tool that we use in the toolbox. We want education to be the tool. We have had to go out already today and make sure that we have an establishment that was staying open and mandating it to be closed. So we do have examples of that already. We do not want that to continue. So we are expecting, for all reasons, people follow the order. It does mean that there are some restrictions. It doesn't mean, though, that people can't do anything. So a reminder again that essential activities can happen, that going outside can happen. The expectation is that you keep your circle very, very small. If you're going outside, you go with only family members in your household. You are not meeting your friends at the park to play baseball or cube. You are going with your family, maybe your son or daughter, to pitch a baseball at the park, you and your child, not with all the neighbor kids. Again, I think people should understand the intention is that you stay with your small group, people that live in your household, and you limit contact with anybody else except for essential times leaving your house to get groceries, medication, and other things. The goal, again, is that we protect those people that are responding and we keep the number of people that are ill at the same time as low as possible. The other part of the order that is critically important is the 6 feet social distance or physical distance component. We are told we have to keep 6 feet apart no matter what interaction we're having. So please be mindful of that piece of the order, that in this room today, we are all 6 feet apart. We will continue to do that in our incident command and our emergency operations center, which is our place where we're doing our work. We are 6 feet apart, and we need to continue, no matter where we are at, to abide by that. Of course, in your home, you do not need to stay 6 feet away from your family members. That's the exception. That's your small circle to keep tight and hold close. Again, this is extraordinary times. I don't know that anybody that is around now has ever gone through something like this before. We know it's hard. We're asking people to keep calm, to stop the spread, and we're asking you to find new ways to reach out. Last night I was fortunate enough that one of my young adult children figured out how to do a meeting with family members for a short amount of time that I could join it. I got to see everybody visually that's not sitting in Eau Claire. So find some creative ways to do some of those things so you can stay connected. That's important to all of us personally. If you see violations of the order, and if you're concerned about violations of the order, do not call 911, please. Please call the COVID call center. That number, again, is 715-831-7425. If it is after hours and it's an extremely concerning incident of that, the non-emergency number is a possibility, but we can't overwhelm our emergency systems. We have gotten questions about grocery stores. There will be some additional postings and some resources with simple messages about grocery stores and how to stay safe. Again, when you're shopping, please think about good hand hygiene. Wash your hands, use disinfectant. The stores often provide those to clean the cart. Do that. Maintain 6 feet. Don't walk into the store and see your best friend next door and get up close and start talking to them. That's a space you should be 6 feet away as well. Don't shop if you're sick. If you are ill, stay home. Find someone else to grocery shop for you. It is allowable in the order, if you are sick, to have someone else pick up groceries for you and drop them on your porch. Make arrangements to do that. So again, essential services are ones that we need to keep operating. If someone is wondering about whether they have, if they're providing an essential service, we're getting questions about that. The WEDC website is the best one to check, WEDC. The link of that is on our webpage and provides some really clear information for businesses. It's also a place that if the order didn't consider a business that's critically important, you can send a form there to say, I think my business is important, could you consider this? So do know that that website is a place to go statewide and certainly in Eau Claire. There is also on our website a link to the frequently asked questions that the governor's office has put together around the order. Those frequently asked questions are many of the ones that we are getting at the health department, so look at that as well if you have questions. Today, again, we have Dale Peters here to share a little bit more about what government is doing in their essential services to make sure that our community can continue to be strong and safe, and he will be sharing that with you now. I'll be back after that to close out and answer questions.
Thank you, Liska. Indeed, things are changing very rapidly, and these are unprecedented times as we continue to adapt and adjust to the different rules and regulations and orders from the governor, and just to prepare for the COVID-19 virus. Please know that at the local level, towns, villages, and cities are working together. We are in communication to provide the essential services that are expected and required at the local level. We are doing things like building redundancy into our systems. We are backfilling different positions. We're doing a lot of cross-training. And things like water and sewer and police and 911, those services are going to be there. They are essential. They are critical to the fabric of our community and are going to be there. And I've said it before, but would reinforce again, the water system is safe and the water system will be there, and the water system does not need to be a concern as we go forward addressing the COVID-19 crisis before us. Local government is also working very hard to support the ICS, or Incident Command System, that Liska talked about, providing many resources and people to staff the different positions that are there. The Incident Command System is a very effective way to manage something like this, and it does provide an opportunity, and it encourages and supports and requires that people across different boundaries and barriers and organizations come together and work together under one system for the entire benefit of the community. And I can assure you that that is happening in this community, that the Incident Command System is being well-staffed, well-run, and well-supported by all of the local government, as well as many, many partners and institutions in the community. I want to build a little bit on the impact of the governor's order that came out yesterday, and Liska talked about it. Of course, that order is to stay home and only do essential travel. And for us, it's to provide those essential services to you. Keep in mind, as Liska said, in maybe a slightly different way, this order is meant to protect you, to keep you safe, and to keep others safe. Or another way to put it is by you are helping others who are then helping you. If you can follow this order, respect the 6-foot distance, only go out for essential services, you are helping those who are helping you keep your community function, and also helping those who will help people who are sick or ill with this. A couple of the mechanics that are related to this: all the municipal buildings in the county are now shut down to walk-in traffic, but know that your local government at all levels, city, county, village, and town, is still open for business. And you should contact them if you need things, either online or using the phone. There's also the election component. We have an election coming up on April 7th. It's your constitutional right, it's your constitutional duty to be able to vote. And there's a lot of work and creativity that's being put into having those elections still continue in ways that are safe for you and for the poll workers that want to participate. The number one best way for you to still participate in an election is through an absentee ballot. And you can request your absentee ballot at myvote.wisconsin.gov. That's myvote.wisconsin.gov. You can request an absentee ballot as long as it's returned to the clerk by the election day for processing. You can do that. We do have other options, though. In the city of Eau Claire, if you have to register, which is something you need to do and mostly can't be done online, that can be done through a drive-through process that's been set up in the hall of the City Hall parking lot. And if you're not in the city of Eau Claire, contact your clerk for how you can work with the voting if you are not able to, for one reason or another, use the myvote.wisconsin.gov. Liska talked about being able to get out in the parks. In your small group and maintaining that 6-foot distance with anybody else that you encounter, we encourage that. Spring is coming. It's good to get out. It's good to get fresh air. It's good to hear the birds. It's good to have that perspective when all this other chaotic and uncertainty and frankly some fear is out there in the community. So take some time, take those walks, get out in the parks. The parks are open, they are available, and they're there for you to use. The playground equipment, however, is off use, and we have limited the use of the playground equipment, again, to help protect the spread of the coronavirus so that people don't get the COVID-19 through use of the playground equipment. So please get out, use the trails, use the parks, but stay off of the playground equipment. Again, all levels of government are working together very closely, and all levels, the towns, the cities, the villages, and the county are working together in communication to keep the essential services going through you. We're working together, we're being creative, and there are other things that are going to continue to happen in this new normal. You will see that roads are still being repaired. There's going to be some constructions of roads. The street sweepers are still out at night, and we have heard that people would like the odd-even parking, at least in the city of Eau Claire, to stop as soon as it can. Please know that we are working as quickly as we can to get the sweeping complete so that we can lift the restrictions on the odd-even parking. And then there's the matter of electeds, our legislators at the local level having meetings. And how do we do that under these orders? On Tuesday, the City Council was actually one of the first local boards that had a meeting, and we worked through that. It was a little bumpy and perhaps not perfect, but please know that we are working very hard to have a process where there can be an electronic mechanism that has transparency, provides openness and effective local government, and going forward we will have a better technology available that allows not only the council members or the village board members to be able to meet remotely, but for the public to be able to weigh in and as well as be able to see and have transparent local government for you. Also know that we're listening and we hear you. And that we are being responsive and anticipating this crisis that's before us. There's a lot of people that are digging deep and they're being creative, and they're anticipating. We're learning from other communities around the country and around the state. And all of this effort is being fed into that incident command system, the planning, the preparation, the anticipation, and with all the community partners, we are preparing for the COVID-19 virus to be coming into the community and anticipating as well as we best can to have the resources available to address it. But in spite of all of this, remember that we are still a community. We're a community of people that live together. And as Liska talked about, it's important that we still socialize. It's important that we still stay connected. It's important that we still remember that we are a neighborhood, we're a community, we are a city, we're a town, we're a village. There are some incredibly creative things that are out there. I heard recently about a teddy bear hunt where people walking down a sidewalk can have their children in their small groups, separated by 6 feet when they meet other people, looking for teddy bears in windows, or people that are writing notes on chalk on the sidewalk, or that there's different unique neighborhood ways. So remember, it is very important that we take this order seriously. Please stay in your home, and when you're out, respect the 6-foot distance. But at the same time, support each other, lift each other up, reach out, and together we will get through this.
Thank you very much, Dale. I think we really want people to know that this community in some ways is really unique. Our Eau Claire County partners, as Dale has shown you, and across the county with all of the individuals and organizations responding, we're working together, and that makes an enormous difference. I certainly appreciate it in my role. We know that we're all social beings, and this is hard. We know it's challenging and very different from what people are used to doing. But again, as Dale said, and as we've repeated multiple times, as we've had different orders come down, it's critically important that we follow the orders that are in place and that we keep the spread of disease slowed down. This is a science-based approach, and if we follow it, we expect that we will have a slower course of disease onslaught in this community. We need that. We need that for our healthcare providers. We need to not have a large group of people arriving at needing healthcare services, the urgent healthcare services that may exist. We need you to stay home because of that. So again, it's tough. We're counting on you. We know Eau Claire residents want to do the right thing, so we expect that that will happen. A reminder, coronavirus.eauclairehealthdepartment.org. That is a resource for you. We are keeping that up to date every day, multiple times a day with the newest information. The call center number again, 715-831-7425. Our ask again is to first look at the website, see if your question can be answered there, and then call if you are struggling to find a response. Again, try and stay calm. It's hard on all of us. Stop the spread Eau Claire is our hashtag. Show us examples of how you're doing that. We'd like to see it. And stay connected to your support systems. It's critically important in these times. We are available for questions now, so if there are questions, we'll entertain those. Thank you. Yes?
For Dale?
Yeah, I'll repeat that and then we'll have Dale come up.
So, as my understanding, the city of Green Bay is suing the governor over the April 7th election. Two-part, I wonder if you have any comment on that, and if the city of Eau Claire has given that any thought.
Sure. So the question is related to what is the city of Eau Claire doing related to the election? Another city in Wisconsin is suing about that election process, and Dale will respond.
Thank you. We are anticipating that the election is on, and until the legislature were to change that, we are taking the precautions to protect the poll workers and be able to have an election in this very unprecedented time. So we are not contemplating a challenge to that. We will follow the orders or the directions that come from the state, and at this point that direction is that there will be an election, and therefore we are doing everything we can to prepare for that and be able to have an election that is credible and provides opportunities for our citizens to be able to participate in their civic right and duty.
Additional questions? Yeah.
What's been your assessment so far of how people, are following this stay-at-home order? I know it's only been a day, but
Yeah. So the question is, what's our assessment of following the stay-at-home order? Again, it started this morning. It is our understanding that people are staying home. Certainly, as we find out of instances where that's not happening, we will start with education and, if necessary, enforce. It is not my understanding that that will need to be a tool that we use frequently. Right now, the important work is making sure everybody understands it, because for some people, it's not clear why this should apply to them. They feel healthy, they feel like, what's the problem? So really making sure we get good information out about why this is important for everybody to follow, not just certain people. So at this point, I have not heard of significant issues with individuals not following the order, and we're expecting that to continue. Yes?
were you able to look at the order from yesterday a little bit more closely in terms of the maximum grouping from 10 to 5, and can you give us your interpretation of that?
Yeah, so yesterday there was also a question about the number of people gathering. The mass gathering order last week, Order 8, talked about 10 people. The order itself does not specifically indicate 5 individuals, and that was the question just posed, and what does that mean? The Secretary's office during the governor's press conference did talk about the encouragement to make your group as small as possible. It's the same message we've been giving here about make your circle small. You may have more than 5 people in your household, and that's not a problem. The issue is make your circle small. And it's not about your circle at any one time, it's your overall circle of people as small as possible. So the order speaks to staying home unless you're an essential worker. If you have 5 people in your home, that is your circle, and that is what the order means to you. The order itself does not list a number. No, that's fine. Yes.
We've gotten phone calls, emails from people wondering, like, why it is that certain numbers aren't being reported. Someone at this facility had it, this person had it, and it's not being added. Can you just maybe speak to the whole process of how you guys are notified?
Sure.
On if it's a positive case and if there happens to be a death in Eau Claire, if it's directly tied to the COVID-19 or if there was some other, problems that the person had.
Sure. So complicated question, but the question generally is how do we get numbers about cases, about deaths, about the things that we post on our website, and what's that process? We are going to have someone come to a media briefing this week to walk through that in more detail, but I will quickly say that COVID-19 is a reportable disease. So anybody that does testing and the labs that do the test, as well as the providers that hear the results, are required to report a positive to the health department. There are some individuals in the community that are a bit confused about whether they are a case, and they may be a contact and understanding I'm required to stay home, so I must be a case. So there has been some confusion in the community about that, but the number of cases based on testing is a required piece of information. Because there's community spread, we know that there are likely more cases of COVID-19 in our community that have not been identified because those people have not been tested. That's why this order is so important. That's why 6 feet distance is so important. The only way that will prevent spread is by some physical distance between people. And while that's difficult to understand, we know that every person that is COVID positive in Wisconsin has not been tested and identified in that list of positives. So critically important now to assume that others in this community have it. And the reason that we are doing these measures is to say, protect yourself and protect others so that we don't spread the disease even more. We will have someone walk through some of the details about how we get the numbers and what that process is. The same process exists for fatalities, that is reportable to us if it is at the time of death identified as a COVID positive related death. So there is a process where that reporting happens and those deaths are reported. Yes?
Kind of going back to the grocery shopping thing. Mm-hmm. Is there any more advice that you could tell people how to stay safe when they do that?
Yeah. So the question is, how do we tell people to stay safe when they grocery shop? So first of all, groceries are essential. Make sure you're eating healthy food and making sure that you have the ability to, if you can't grocery shop, that someone does for you. We don't want people to not have healthy food. As I said earlier, if you're going to a grocery store, make sure you go when you are healthy. That's the first thing that we want people to know. Wash your hands, clean the cart. Don't buy everything at the store because you're scared and you're not sure that if you're going to be able to get back there again. Hoarding is not something that we want. Grocery stores will stay open. And again, If you need some assistance or you're concerned, make sure that you touch base with family and friends. When you're in the grocery store, make sure that you are staying 6 feet away from others. And that's a critically important measure. We have been working with grocery stores to make sure that they understand how to keep people as safe as possible. And we're encouraging them to do things like, for those people that are responding to this incident and for the elderly who are most at risk of disease, to think about ways to message to customers about times when we can have those people go in. And we know some are doing that. Some of our local grocery stores are doing that. We're encouraging grocery stores to disinfect carts, to make sure cleaning supplies are available, to make sure they're keeping their employees healthy by keeping distance, and keeping customers separated from each other in lines and those kinds of things. So really, if people go into grocery stores like any other public setting, think about space and thinking about washing your hands and thinking about only going out if you are healthy. Yes?
Can you address some more specific outdoor activities that people might be wondering about as the weather is nicer? For example, like hunting or fishing, tennis, pickleball, some of these activities that are specific. People have questions about, for example, kind of meet up with a buddy of mine to go out to meet in spaces. Can I play pickleball outside with someone that's not in my household?
Sure. So the question is for social activities, what are the real restrictions besides just it's okay to go outside? There's lots of subtlety to that. The basic premise is that if you are with your household members, you can go outside. If you are not traveling by car a distance, you can go outside. So some of the examples shared, if you are meeting your buddies at the park to play baseball, that is not an acceptable activity. If you are going with your kids to play a game of pickup kickball, that's okay if those are kids that you're living with and your household members. Similar to any other small group activity, again, if it's with your household, that is acceptable. If it's not with your household, this order says that you are not to do that. Non-essential travel is also restricted, so traveling somewhere to do an activity is also not part of the expected activities. So again, we're encouraging people to go outside, we're encouraging people to be active with their household members, but really, unless it's an essential activity that you are doing, that travel there is not acceptable. There are some exceptions in the order related to things like state parks, but again, really limit your activity and limit your contact with others is the expectation. Again, we'll get more clarity on the details of those orders, but the overall goal is to stay close to home.
And just a quick follow-up on that. So say if, I wanted to drive to Phoenix Park to go for a walk in the park, that's not essential travel, that would not be allowed. But if I wanted to just go take a walk around my block, that would be allowed.
So the question really is in the subtlety of, can I drive to a park to walk? And again, we'll do some more review of the order about the details. The idea of the order is that non-essential travel is really discouraged because of the potential contact with new people. Certainly, some people may need to travel to do some of those activities, and we'll get some more clarity around that. I think it's a reasonable question to ask, and I understand it. My recommendation at this point with the order is, again, essential travel, and if you can connect that with something else that you're doing, that, to look at that as a possibility, but we'll get more clarification on that. Yes?
You were saying earlier how a lot of people probably haven't lived through something like this.
Yeah.
Given the fact that we're taking these extreme measures, if we hear maybe in the future there's something new in Europe, there's something new in the US, could it potentially become the new norm, I guess, of a reaction to something that we may not have a vaccine for at the time?
Sure. So the question is will this become the new norm for a disease that may be new, that we don't have a vaccine for, or we don't have an easy response for? Again, in our public health world, we really work to use the right tool at the right time. This disease is different than many that we've had in the past because of how communicable it is and how quickly it's spreading. And because of those, this is a unique response. I can't say that it will never happen again. We may have diseases in the future where this kind of extreme measure will need to happen, but certainly we have lots of other tools in the toolbox to deal with disease outbreaks, and we always try and start at the least invasive way possible. Did you also have a question?
On the way here, I mean, I also work downtown, and I was, it seems like people have done amazing by clearing out. It's somewhat ghost town, I'm sure, right, you agree. But on the way here, I saw 3 folks right in front of a bar, huddled, violating the rule, you know, and I feel like I'm tattling on them. But, I mean, we get a pep talk every day because we hear you. So, and we're trying to convey the message, right? And like, go beyond us, I guess, to try to address, you know, per capita, Eau Claire's right up there in terms of bars, people are missing their friends, so I know we've heard it from you a lot of times, but.
Yeah, so the question is, how are we making sure the message gets out broadly? The example being, you know, people congregating together in violation of the order outside of a local tavern or a local bar. There are lots of tools we're trying to use to get the message out. We know that that's difficult. All of our licensed establishments, bars, restaurants, grocery stores, and others are getting direct communication from Incident Command and the health department about measures that they need to be taking. Certainly any time we hear of an example where it's clear that that doesn't appear to be happening, we are taking it seriously, and we are going out, and we encourage others to make sure that they are reminding friends and family. I'll tell you that, you know, today it's an instinct that we have to get closer to each other. And today I've seen multiple times in this building people say, "Oh, 6 feet apart." So take responsibility and help each other remember. Again, I think most people want to do the right thing. We have to retrain ourselves, and that's hard. We count on all of the people listening to this and all of our partners to get the message out. So places like the Chamber have been a huge asset in Eau Claire to get messages out to the business community. We'll continue to count on them as well as others. So thank you again. Lots of information today. We will be back again tomorrow. And again, look at our website if you would like to get the current information as things are evolving.